Good day to all. Firstly, I would like to thank the organizers for inviting me to share the REBUNG experience that was implemented in Klinik Kesihatan Taman Medan, my former clinic. I hope by sharing this experience, those who plan to implement this concept will have some rough idea on how to do so. REBUNG stands for Reducing Barriers in Cancer Early Diagnosis in Urban B40 Group. It is well known that urban B40 is a marginalized group, and most of the time, when the diagnosis of cancer is made, it is already too late. Therefore, REBUNG project was set up in hoping we can reduce some barriers in cancer early diagnosis in urban B40 group. It all started in January 2022. It started with the REBUNG Cancer Care in Primary Course short course, whereby there was introduction to a variety of different common cancers, the top 3 to 4 cancers worldwide and in Malaysia. Followed by, in March 2022, a letter to our clinic and the other clinics involved to start this REBUNG project implementation. So we had a few meetings and a few gatherings to discuss on the implementation and how to go about it. For the implementation to be successful, we need to get the buy-in from the clients, which were the Taman Medan residents, to come forward for cancer screening. So we did a few promotion strategies, which consist of flyers, videos through social media such as Facebook, through our Klinik Kesihatan Taman Medan PKD Petaling, and even WhatsApp to our panel advisory clinic, as they are one of the community leaders in the communities in Taman Medan, to inform their communities that there is such services and to come forward for screening. At the same time, we also promoted this service to our patients who attended the clinic for non-communicable diseases or even for cough and colds, to make them aware that this service is available for them to be able to come forward for screening, at the same time to promote this service to their friends and family members. We also did outreach programs such as health campaigns in collaboration with MPs to promote this service. Not only that, we needed to have a proper structural flow chart refer to LPPKN for our mammogram and also to the tertiary centers, which was our main referral centers. Hospitals were Hospital Shah Alam and PPUM. And of course, not forgetting, we will want to work with the GPs nearby in our clinic, because the patients do go to GPs, and by providing assistance to GPs with a covering letter to waive off the fees when referred from private GPs to MOH hospitals, meaning the GPs are the one who do the screening, but in order to get the waiver, the fee waiver, they come to the clinic and we will attach a covering letter so that they will be able to waive off the fees. This is only particular for those under the REBUNG project. At the same time, besides the buying in and getting collaboration with the GPs, we also needed to give knowledge to our medical officers on what is REBUNG and what to interpret if there's abnormal results, and what next to do during the next appointment when coming to review the results. So these are examples of how we did the promotion strategies. If you look at this picture, we had a triaging in this area, whereby the patients, when they come for their non-communicable diseases, they will take the blood pressure and their height and their weight. So at the same time, while taking the blood pressure, they will look at this paper. It will be promoting when they should be doing their cancer screening. So hopefully that will open up a conversation, and they will talk to the staff who's doing the vital signs that, oh, they are interested. And we also put all the forms all available, so when they enter the doctor's room, the doctor will know that this patient is interested in doing cancer screening, such as HPV DNA for cervical cancer, and breast cancer is mammogram. And at the same time also IFOBT for colorectal cancer. We have multiple colorful flyers so that people will be more attracted and will be interested to do the screening. And this is also an example of our outreach program, which we did at the mosque to promote our services and at the same time to tell them, okay, this is how they can make appointment to do the cancer screening at our clinic. So in our clinic, we have 3 types of cancer screening. For colorectal cancer, it's IFOBT. For cervical cancer, it's HPV DNA and Pap smear. And for breast cancer, it's mammogram, whereby we have to refer to the hospital that is designated for us. So beginning in January 2022, after the meeting, initially we had QMed, a type of appointment system. So we taught the patients that you have to click at the outpatient column, followed by there is a specific column for cancer screening at that time, so that it will be faster and we can open up some space, because if not, it will be saturated with other types of outpatient issues. So we have a specific column for saringan cancer. Then later, in 1 year later, we converted to My Sejahtera Temu Janji, and it was also outpatient treatment, but unfortunately we couldn't make it into specific for cancer screening, so we had to open up more slots in the outpatient because it mixture with other outpatient complaints. But for HPV DNA, we have made it easier to fast track because we do have the HPV DNA screening available in our clinic easily compared to mammogram, whereby we have to refer to the hospital. So this one is without appointment. Whereas for the other cancer screening, they have to take the appointment through the My Sejahtera, but we're open from Monday to Friday, 8 p.m. to 5 p.m. So this is how the My Sejahtera appointment system looks like in the Klinik Kesihatan Taman Medan. Okay. And then we created a few different types of referral flow, especially mainly for the mammogram, because we do have cases whereby patient came in with a breast lump, and of course obviously we need to speed up the appointment system. So ours was a bit different. We had a understanding with Hospital Shah Alam on it to speed up, as long they have the chop of REBUNG, so it will fast track for us. And of course, this is the example of a covering letter for the GPs. If they actually do have patients that have interested in cancer screening seen by the GPs, but they want to go to the government facilities, because ours got a fast track a pathway, so we will attach a covering letter so that the patient will have a waiver fee. So these are the examples of flyers and information, so that, for example, for patients who have been diagnosed with cancer, they also can do PKB40 in the clinic nearby to get the assistance. At the same time, we also had CMEs to the medical officers in Klinik Kesihatan Taman Medan, so that they are aware of what is REBUNG, what to do next. Because we cannot depend on only just one particular medical officer. For example, in my clinic, we had one designated MO, which is good because there will be stability, but at the same time, you need to think of sustainability. So when it comes to sustainability, you definitely need to do regular CMEs to educate the staff, as there's a very high turnover of staff. Then at the same time, we had site visits from community navigators from the UM team and also Klinik Kesihatan Kelana Jaya, which also is part of the next project, REBUNG, if not mistaken, REBUNG 2.0. So of course, the challenges as usual is the high turnover of staff, mainly for sustainability and continuity of this project. That's the biggest challenge that most clinics will face if they were to implement any project as such. At the same time, we want to teach the public to fish and not giving the fish, meaning that we want to empower them to be community leaders, to create awareness and encourage their own people to come forward for screening, rather than we all going all out to encourage them to do screening. That means their own people encourage their own community to come forward for screening. And hoping to create a norm that cancer screening is a must. It's just like screening for diabetes. People just come in to screen for diabetes, just want to check the dextrose or take a blood. So we want it like they come forward just for cancer screening. They are still well, but they want to do cancer screening. And we hope for stronger public and private partnership and active involvement from community leaders for accessibility. So this is one example of how we collaborate with the community. Hopefully there will be more people on board on this project, especially to help the urban B40. And hopefully there will be more of fine-tuning of the flow of Rakanku, which is a community navigators with the primary care team, so that they'll be more proactive in this cancer screening. I hope that after this talk, you will have a rough idea on how to implement in your individual clinics, possible strategies on how to get the buy-in from your clients, which means your patients nearby to your clinic, and how to get your team members in your clinic to make it successful. I'm sorry that I'm not able to attend and give this talk face to face. I mean virtually. It's just a recorded session. But if there's any questions, do not hesitate to inform the organizers and they will email to me and I'll get back with the answers. Thank you very much and have a good day.